Reverse pressure softening is aimed to soften your areola by pushing any swelling away and using that pressure to shift milk and fluid away from the nipple. It's designed to promote a deeper latch, have a better milk flow from obtaining a deeper latch when you're breastfeeding baby, and reduce engorgement. Hi everyone, welcome to Lactation with Amy. If you're a new mom struggling with breast engorgement, you're in the right place. My name is Amy and I'm a midwife and a lactation consultant. Today I'm going to show you a technique called reverse pressure softening that can help relieve discomfort and improve breastfeeding. Reverse pressure softening is useful if you've had no issues or discomfort with breastfeeding in the first few days until your milk came in, your breasts are firming up, baby is taking longer to latch and struggling with latching deeply because of how firm and hard your breasts are. So if this is you, you need to watch this video. Why does feeding hurt so much more when your milk is in? Shouldn't it hurt less? Using a balloon as an example, it's so much easier for your fingers to grip the balloon when it's nice and soft. Now, if we compare it to this balloon, your fingers slip when you're trying to grab it. This balloon represents your breast and the fingers represent your baby's mouth. It's a lot harder for baby to manage to maintain suction and that deep latch on a really engorged breast. Luckily, this doesn't last forever. Engorgement with your milk coming in usually gets better around 72 hours. Please keep watching this video and I hope this simple technique will make breastfeeding much more comfortable for you. First, begin by palpating around your breast and your areola. You want to feel around your breast and how firm it is around each area. If you're trying to shape your breast and just shape where baby's mouth would go, the nipple and the areola area may feel quite swollen and not very shapeable. With this technique, we're going to use 3 fingers on either side of your areola. You want to put it about where your baby's mouth would go. Baby's mouth would go around here. We would put our fingers here. You want to put 3 fingers on either side and push back towards your chest wall and hold it for at least a minute. So this is a pressure straight down towards your chest wall. You would press and hold. Once you hold it for a minute, you can let go. You may see your fingerprints dinting into your breast. This is a sign that there is a lot of swelling on your breast and that you should probably continue to perform the reverse pressure softening before breastfeeds. Now, once you let go, if you try to shape again vertically, you'll notice that your breast feels a lot more softer and shapeable after the reverse pressure softening. Now that's helpful, we're going to do the top and bottom. Sometimes it can be quite hard to use 3 fingers on each side around here. So you can use 2 fingers and 2 fingers. Same thing, you want to place it where your baby's mouth would go. You want to press in towards your chest wall and hold it for at least a minute. After you do it vertically and horizontally, the entire areola, at least where baby's mouth would go, should feel a lot softer and a lot more shapeable. So with that swelling and milk pushed back temporarily, it'll be easier for baby's mouth to latch and form that suction and latch deeply. With this skill, some people also prefer to use one hand and their fingers going in and pushing towards the chest wall like this. Just be really mindful because if you have really sharp nails and you're digging in at this angle, I find that it can be quite painful for your breast. Ideally, you don't want to pulsate your fingers because this is not a massage and we're not trying to actively hand express your milk. So use just the pressure of pushing back and holding it there for a minute or 2, not a pulsating sensation. We also don't want you to push back and pull your nipples away. So with the engorgement happening, your nipples will already feel quite tight. Your skin is really tight, stretched out and uncomfortable. So if you're pushing back and also moving your fingers sideways, that's probably just going to cause you extra discomfort and maybe some cracks in your nipple if they're starting to heal from early damage. You may see a little bit of milk leaking while you push the pressure back. That is quite normal, so you can just let your milk drip. Once your breast has softened with reverse pressure softening, you can then try to latch baby on. Because we're temporarily removing the swelling away, it does not last forever, so you might need to do it within 5 to 10 minutes of latching baby. If you are exclusively pumping, you can try to watch for the flow after the reverse pressure softening and see if the flow is any better. You may also need to do some lymphatic massage or repeat the reverse pressure softening halfway during your pumping session, as a lot of the time the suction from a pump can easily move the swelling forward towards the flange of where the flange is touching your breast. Reverse pressure softening should be done before each breastfeed or expressing session. If you're seeing dents from your fingerprints after you do it, it really tells you that there is still some swelling on your breast, so continue doing it for a few more days until your breasts are feeling softer. If reverse pressure softening does not successfully soften your areola enough for a baby to latch deeply, then you may need to repeat it or hand express to further soften your areola. Reverse pressure softening does not last forever. Depending on how severe the engorgement is, the fluid can quickly come back after we perform this. So do it right before a feed and repeat if you need to. Remember, if a baby is crying and hangry, they don't have the patience to wait for a deep latch and wait for the milk to come when they're breastfeeding. So you may need to get the baby to suck on a clean finger and give them some express milk before they're trying to latch. If you find the reverse pressure softening helpful, you may need to do this technique each time before you latch the baby until your breasts are less engorged. It usually takes about 48 hours for the engorgement to settle if your baby can effectively and efficiently remove milk. If your breast is still quite engorged, watch this video about lymphatic massage and see if it helps you produce a better milk flow. Some common mistakes to avoid when doing the reverse pressure softening is that you really need to press and hold that pressure for 1 to 2 minutes. Don't push too hard on any other area of your breast, only where your baby's mouth needs to go. For example, when you're doing a reverse pressure softening and your baby usually puts the mouth here, you don't want to do it right here where your breast tissue are. You only want to do it nice and close where a baby would latch. Same thing here. If your areola is smaller but your baby usually latches further than your areola, then you might need to put your fingers here. If the engorgement continues, or if you notice signs of infection like fever, redness, severe pain, and no milk flow despite doing the lymphatic massage and reverse pressure softening, you should probably seek help from a lactation consultant. If you have any questions or if there's something you want more clarification on, leave a comment down below. I would love to help. Remember, motherhood is a journey. There's lots of challenges. Breastfeeding itself is a journey. It's challenging but rewarding. Lean to your village, don't hesitate to ask for help, and give yourself grace. You're doing a great job. If you find my videos useful, please give me a like so that I know it's useful. I would love to continue making content like this. Subscribe if you want to watch any similar content, and I will see you in the next video. Bye!